Welcome back to the Science of CBD. I'm Gene Bruno, Professor of Nutraceutical Science at Huntington University of Health Sciences, formulator of Twin Lab products, and your host. In today's podcast, we're going to discuss the World Health Organization's new position on medicinal marijuana. So what does this have to do with CBD? Well, just this. Marijuana and hemp, the plant from which, CBD is derived, are the same species, but they're just a different variety. And besides that, there's been a great deal of research using both of these plants and their extracts together. So here it goes. The World Health Organization is calling for whole plant marijuana, as well as its cannabis resin, to be removed from Schedule 4, which is the most restrictive category of a 1961 drug convention signed by countries from around the world. Now, the World Health Organization also wants THC, the psychoactive chemical in marijuana, and its various derivatives to be completely removed from a separate 1971 drug treaty and instead added to Schedule 1 of the 1961 convention. Now, marijuana and cannabis resin would also remain in Schedule 1 of the 61 treaty. They're currently, dual designated in both schedules, Schedule 1 and Schedule 4, but Schedule 4 is reserved for those substances that are seen as particularly harmful with limited medical benefits. This is different from the U.S. federal system where Schedule 1 drugs are supposedly most dangerous and most restricted, and they currently include drugs like marijuana, heroin, and LSD. Okay, so the World Health Organization is moving to make it clear that cannabidiol, CBD, containing no more than 0.2% THC is not under international control at all. Now, of course, CBD wasn't previously scheduled under the international conventions, but these new recommendations make it even more clear that that's the case. So if you take this all together, the recommendations, if they're adopted, will represent a formal recognition that the world's governing bodies have effectively been wrong about marijuana's harm and therapeutic benefits. And they've been wrong about it for decades. The World Health Organization's new position comes at a time when there's a growing number of countries that are moving to reform their cannabis policies. As such, a shift at the UN could encourage additional nations to scale back or repeal their prohibition laws against marijuana. Even though legalization for non-medicinal or non-scientific reasons would still technically violate the global conventions. In any case, here's a quote from Michael Krawitz, who is a U.S. Air Force veteran and a legalization advocate who has pushed for international reforms. He says, "The placement of cannabis in the 1961 treaty and the absence of scientific evidence was a terrible injustice. Today, the World Health Organization has gone a long way towards setting the record straight. It is time for all of us to support the World Health Organization's recommendations and ensure policies don't trump science." Hear, hear. That is an excellent quote. I couldn't agree more. But let's back up for a second. What exactly are the medicinal uses of marijuana? Well, in the U.S., the most common use is for pain control. While marijuana isn't strong enough for severe pain like post-surgical pain or a broken bone, it is quite effective for chronic pain that is, the plague of millions of Americans, especially as they age. It is clearly safer than opiates, and it can take the place of certain NSAIDs, such as Advil or Aleve, especially if people who are taking those medications really can't take them due to problems like with their kidneys or ulcers or gastroesophageal reflux. Also, marijuana appears to ease the pain of multiple sclerosis and nerve pain in general. This is an area where there are really few other options, and those options that do exist are highly sedating. Marijuana is said to be a fantastic muscle relaxant, and people swear by its ability to lessen tremors and Parkinson's disease. It's been successfully used for fibromyalgia, endometriosis, interstitial cystitis, and actually most other common conditions where the final A common pathway is chronic pain. Marijuana is also used to manage nausea and weight loss, and it can also be used to treat glaucoma. One highly promising area of research is its use for PTSD in veterans who are returning from combat zones. Medical marijuana is also reported to help patients suffering from pain and wasting syndrome associated with HIV, as well as irritable bowel syndrome and Crohn's disease. Okay, this isn't an inclusive list of all the benefits of medical marijuana, but it certainly sheds some light on the World Health Organization's new position about this medicinal plant. Hopefully, this will also have a positive effect on the FDA and other federal and state agencies' attitude about the legitimate use of medicinal marijuana, as well as the use of CBD. So thanks again for joining us on another episode of the Science of CBD. If you enjoyed what you learned, make sure that you hit like and subscribe. For more information about CBD or to sign up for our newsletter, visit www.twinlabcbd.com.